LSD. LSD is a potent hallucinogen that induces profound changes in perception, including visual distortions and heightened sensory experiences. Users may experience introspective insights and spiritual revelations. However, LSD use may trigger anxiety, paranoia, or bad trips in some individuals. Methamphetamine. Methamphetamine, commonly known as meth, is a potent stimulant that increases energy and alertness. Users may experience a sense of euphoria and heightened confidence. However, meth use can lead to insomnia, paranoia, aggression, and severe dental problems. Alcohol, a legal depressant, initially produces feelings of euphoria and lowered inhibitions. However, excessive consumption can lead to impaired coordination, nausea, and blackouts. Chronic alcohol abuse can result in liver disease, addiction, and cognitive impairment. Crocodile. Crocodile is a synthetic opioid with effects similar to heroin, including euphoria, pain relief, and sedation. However, crocodile use can result in severe skin infections, tissue damage, and gangrene. Chronic use may lead to limb amputation and death. Cannabis, marijuana. Cannabis, often referred to as weed or pot, induces a state of relaxation and euphoria upon consumption. Users may experience heightened sensory perception and creativity. However, side effects can include impaired cognitive function, increased heart rate, and dry mouth. Psilocybin mushrooms. Psilocybin mushrooms, also known as magic mushrooms, cause alterations in perception, mood, and consciousness. Users may experience vivid hallucinations, synesthesia, and a sense of interconnectedness with nature. However, shroom use can also lead to anxiety, confusion, and paranoia, especially in high doses. Heroin. Heroin, a powerful opioid derived from morphine, induces intense feelings of euphoria and relaxation. However, it also depresses the central nervous system, leading to slowed breathing and heart rate. Long-term use can result in addiction, overdose, and infectious diseases from needle sharing. PCP, phencyclidine. PCP, or angel dust, is a dissociative drug that distorts perception and induces feelings of detachment from reality. Users may experience hallucinations, agitation, and violent behavior. Chronic use can lead to memory loss, speech difficulties, and long-term psychological issues. Nicotine, tobacco. Nicotine, found in tobacco products such as cigarettes and vape pens, acts as a stimulant, increasing alertness and pleasure. However, it also constricts blood vessels and raises blood pressure. Prolonged use is associated with addiction, respiratory issues, and an increased risk of cancer. Kratom. Kratom acts as a stimulant or sedative depending on the dosage. It can enhance mood, relieve pain, and increase energy levels. However, kratom use may lead to dependence, withdrawal symptoms, and gastrointestinal issues. Steroids, anabolic androgenic steroids. Anabolic steroids are synthetic variations of the male sex hormone testosterone used to increase muscle mass and enhance athletic performance. However, steroid abuse can lead to mood swings, aggression, and liver damage. Long-term use may also result in cardiovascular issues and reproductive system disorders. MDMA. Molly. Ecstasy produces feelings of euphoria, emotional warmth, and heightened empathy. It enhances sensory perception and promotes social bonding. However, MDMA use can lead to dehydration, hypothermia, and serotonin syndrome. Long-term use may result in cognitive deficits and mood disorders. Lean, purple drank scissor. A concoction made from codeine-based cough syrup, soda, and candy produces sedative effects and feelings of relaxation. It can induce drowsiness, lethargy, and impaired motor function. Misuse of lean can lead to respiratory depression, addiction, and overdose. Nitrous oxide. Nitrous oxide, or laughing gas, is an inhalant that produces feelings of euphoria and dissociation. It can induce mild hallucinations and distortions of sensory perception. However, prolonged use can lead to vitamin B12 deficiency, nerve damage, and impaired cognitive function. Synthetic cannabinoids, Spicec-2. Synthetic cannabinoids mimic the effects of THC, producing euphoria, relaxation, and altered perception. However, they can also cause anxiety, paranoia, and hallucinations. Synthetic cannabinoid use may lead to addiction and cardiovascular complications. DMT, dimethyltryptamine. DMT, potent hallucinogen that induces intense visual and auditory hallucinations, often described as breaking through to other realms or dimensions. It can evoke profound spiritual experiences and insights. However, DMT use may cause extreme anxiety, confusion, or a loss of ego boundaries. Ketamine. Ketamine is a dissociative anesthetic that induces hallucinations, out-of-body experiences, and a sense of detachment from reality. It can also cause sedation, confusion, and memory loss. Long-term ketamine use may lead to cognitive impairment and urinary tract issues. MDA or SALI. MDA is a psychedelic amphetamine that combines empathogenic and hallucinogenic effects. It enhances sensory perception, emotional sensitivity, and sociability. However, MDA use can result in neurotoxicity, cardiovascular problems, and psychological distress. Cocaine. Cocaine is a powerful stimulant that produces feelings of euphoria, increased energy, and enhanced confidence. It can also elevate heart rate, blood pressure, and body temperature. Cocaine use is associated with cardiovascular complications, addiction, and psychiatric disorders. GHB, gamma hydroxybutyrate. UI is a central nervous system depressant that induces relaxation, euphoria, and sedation. It can also cause dizziness, nausea, and amnesia. Overdosing on GB may result in respiratory depression, coma, or death. Bath salts, cathinones. Bath salts are synthetic stimulants that produce effects similar to amphetamines, including increased energy and euphoria. However, they can also cause agitation, paranoia, and hallucinations. Bath salt use may lead to cardiovascular issues and psychosis. Diam, dextromethorphan. Diam is a dissociative drug found in cough suppressants, producing hallucinations, dissociation, and altered states of consciousness. It can also cause nausea, vomiting, and confusion. Misuse of Dux-M may lead to addiction and respiratory depression. N-bombs, 25E-N-bomb. N-bombs are synthetic hallucinogens with effects similar to LSD, including visual distortions and sensory enhancements. However, N-bombs carry a higher risk of adverse reactions such as seizures, cardiac arrest, and psychosis. Salvia Divinorum. Salvia Divinorum is a potent hallucinogen that produces short-lived but intense psychedelic effects. Users may experience distorted perceptions of reality, time, and space. However, salvia use can also lead to confusion, disorientation, and anxiety.